To start? Yes, sir. Okay. Okay, good. It's now good afternoon here, and I'm very pleased to be with you all to give you a short update on the COVID-19 pandemic. And I'll probably give it a slightly different angle this time. And let me talk about a few things that I think could happen in the future. So the pandemic, as you know, started in December 2019, was declared by WHO as a pandemic in March 2020. And the two main questions are really now what is happening and where are we going? So essentially what's happening now is that every country virtually in the world has been affected, and up to now there are about 1.3 million cases, about 70,000 deaths, and that's doubled in 1 week. And the case fatalities remain much higher in the elderly with underlying conditions. There are a lot of variation between countries. The incidence varies widely, and there are success stories, or we think there are, and what can we learn from them? So I'll go back to a graph that I think I've shown previously, and this is the graph that basically shows the incidence of new cases of COVID-19 since the beginning, or virtually at the beginning of the pandemic. And on the blue at the left side is China, and on the yellow on the right is the rest of the world. And the most important thing I want to show about this graph is that China essentially managed to stop the epidemic. That is the most important thing that I want to mention here. So let's look at the successes, and the success story is really China. And what did China do? They had a total lockdown for weeks. They had very sophisticated monitoring of people who were either positive or also their movements. There was a sealing of the borders. They didn't allow people to in and they didn't allow people to leave. And there was widespread testing and isolation of cases and contacts. So where is China now? China is really reducing the lockdown and going back to work. The borders remain sealed. There's virtually no local spread. They are still preparing for the possibility of another outbreak, but they seem to be controlling it pretty well. So what are the transition strategies for the rest of the world? Well, the transition strategies are really more or less three options. There obviously could be more. Stop the lockdown and let the pandemic take its course, and that's obviously not a good option. That's been called sometimes the herd immunity option, where you just allow whoever gets ill to get ill, and of course you pay a heavy price with fatalities, particularly in those who are particularly sensitive, the elderly, those with underlying conditions. The second one is to slow the pandemic down to a manageable level, and that's the current policy. And the third, which is called the elimination of the virus, and that's a dream that I say we perhaps should strive for. So the current strategy is basically slow the spread. And I'll go back to it. This is the strategy of flattening the curve. And that left one is the big one, which says that if without protective measures, we'll have an overwhelming amount of cases that will overwhelm the health services, and slowing it down will actually allow the health services to be able to cope with it, particularly with the serious cases. What's in development? Well, in development, there are more rapid tests for identifying the virus. And this is a very strong research area, and we're hoping we'll have maybe even point of illness tests, and obviously tests to screen people who actually enter the country or move around. So this would be obviously optional to have something that is much more rapid than we do have today. Currently, a PCR test, by the time you take the swab and actually get it to the lab and get it tested, it might take several days. The serology is now well in development. The kits are now available and they are now being distributed. Some are still being tested for their validity, and that's testing for serology. IgM are antibodies that appear a few days after the symptoms, tells you the patient has actually had the disease or is having the disease, basically. And then the IgG, which appears a little later, which remains as evidence that they have been infected, and that probably is evidence that they are now immune. There are many clinical trials underway for better treatment. The World Health Organization has what we call the International Solidarity Trial, which is a huge trial, multinational, and any country can join. And they are testing several options or a number of particular drugs and interventions that we hope will give us better treatment. And then there are vaccines. So the vaccines, there are several under development. They use new technology. There is progress, and I believe phase 1 trials, the first trials should start very soon. Still, I believe it could still take about 18 months before it actually comes into actual use. But, you know, we can be optimistic and hope it's earlier. And then there are passive vaccines, which are basically antibodies that are produced from people who have become ill and have recovered. And you can get antibodies from them to give temporary, sometimes you can use it for treatment and sometimes you can use it for temporary prevention. There is some new technology now to actually produce these antibodies outside of humans. In other words, it would be a laboratory-produced antibody, and that could be a dramatic new development, and that actually apparently is well on its way to actually being tested. So what lies ahead? The current return to work option is basically a slow return to work, and I'm giving you what we assume most countries will do. An intermittent lockdown. So if the number of cases increases too much, there'll be a lockdown again for a few days. It may be done differentially in some regions, and this is what's being done in Israel. We don't actually stop the lockdown, but what we've done is we've isolated areas where there's been particularly high incidence of disease, and we're restricting people from going in or leaving those areas. So there could be regional strategies within the population or within the country. And then there's a very interesting proposition that we go over to a shift work schedule where people will basically work 1 week on and 1 week off alternately, and that will reduce dramatically the number of people who are at work. And on the other hand, we could also, in addition to that, encourage work at home, which is currently being done. And the third option, which I want to give today briefly, is the option of the elimination of the virus. And I know that sounds like it's very much out of space or in outer space. Can we achieve elimination or eradication of this virus? Well, it's obviously a very worthy goal. It's almost never been done without a vaccine. It's true that SARS, the virus from SARS, disappeared. I guess that's because it was a very severe illness and it was much easier to isolate the patients and it didn't spread very widely. But generally, we would talk about elimination or eradication as something that can only be done with a vaccine. So we can start the process until there's a vaccine. So how would we do that? We'd basically seal the borders of the countries for a certain period with testing or quarantine of anyone entering. So anyone entering would have to undergo testing or quarantine for 2 weeks, and this is largely being done. And this would be put in place for a long time. Partition the country into smaller areas with intensive testing and isolation of contacts and cases, and remove them from the healthy people. And then try and eliminate the virus country by country. I know this is a daunting task, but this is something I think that we should think about. The question really, is this just a dream? Well, maybe. But you know, there's a saying that I quote now from Lawrence of Arabia, T.E. Lawrence, who talks about dreams, and he says, all people dream, but not equally. Those who dream by night wake in the day to find that it was vanity. But the dreamers of the day are really the game changers, for they act their dreams with open eyes, and that makes them possible. So let's dream with our eyes open. All our efforts should be geared towards elimination. Even if we don't succeed, these efforts will make the virus more manageable. And when the vaccine becomes available, we'll do what is necessary to do what we did in the eradication of smallpox, and we'll eradicate the coronavirus. Thank you.
Thank you very much for joining us again, Dr. Green. feel free to tune in every Monday. Dr. Green will be live with the American Society of the University of Haifa, providing a weekly update on the coronavirus. Thank you very much, and until next week, take care.
Thank you.